my children's generation and your children's generation is the first generation not to outlive their parents. They have more chronic disease. In the last 50 years, the health of children was said to be somewhere between 3% and 6%, meaning chronic disease in children. Today, it is over 60% chronic disease.
My little one was having recurring ear infections. We get the bill 3 weeks later, and it was $8,000 for a 15-minute procedure. 3 weeks after that, I got a note from my health insurance plan that says, we're not paying for it. It was medically unnecessary. She's got a hole in her eardrum. What are you talking about? It's not necessary. She went from screaming all night, every night for weeks to actually sleeping. I come to find out that I could have gotten that surgery for like $1,500. I found out health insurance was putting about 200,000 families every year bankrupt. If I have $1,000 of premium, the insurance company can only make $150. So how do they make $165? They grow their profit by 10%. My premium has to go from $1,000 to $1,100. If you pay in cash as opposed to going through your health insurance, it's way less.
Doctors have to get out of the system. Patients have to get out of the system. You've came up with a better way for people to do just that. What is it a month? Do you have different programs? Is there a deductible? How does it work? Well, Andy, thank you for being here. And I'm excited for this. You're the guy who's known for disrupting one of the most entrenched businesses, corrupt, I would say, businesses, in America for sure. That said, because you're a disruptor, I want to rewind the clock a bit, and find out what kind of person you are.
Okay.
As a kid, I mean that. People that disrupt things, they're always a special person behind that, and we have an amazing Pain to Purpose story, which I cannot wait to get to, because Pain to Purpose is why I'm here. That's the name of the podcast. So, but let's start as a kid. What kind of kid were you?
It's so funny. It's something I probably should think more about, because I was actually like very much a rule follower. Like, go follow the rules. Like,
okay.
Don't drink until you're 21.
You've surprised me already, because
I know.
I wouldn't have thought that.
It's crazy.
Yeah.
I grew up Catholic, and so it's just like all these.
I grew up Catholic.
Oh, did you?
Yeah.
So all these rules.
I became agnostic, and then I became what I would say is a believer, a real Christian.
Yeah.
I don't know.
Oh, my journey
is Catholics, but you have to understand. Like, I was an agnostic, and going, oh my gosh, this is about do's and don'ts. I hated it.
Similar, very, very similar story.
Okay, yeah.
So you grew up just like following the rules. Like you don't drink until you're 21. You don't do all the other things that kids were doing. So I was very much a rule follower. And I was kind of like that all the way through college and even beyond my first job. And I think it started when I went out to Stanford for business school, which is just a disruptive place.
Yeah.
You start thinking outside the box.
No, wait, what year was that you were
That was
Stanford?
2000. I went out there in 2004.
Okay.
So, you walk down University Avenue and Steve Jobs would be walking, the other side of the street.
I could get so caught up in this because this is just totally my curious mind. Stanford today is a place that I probably I definitely wouldn't fit in, but I would definitely be like, I don't even want to go down there. Everything that is going on there, even politically. But what was it like then? Was it really different?
You know what? I don't think I was that politically engaged actually back then.
But that's the point, though.
But
yeah.
No, and I think I wasn't politically engaged. I was into classmates that were from all over the country.
Yeah.
Typically they were from the coast. I remember having this really interesting conversation with my classmates, being like, "Oh, like they sell things at Walmart," and they looked at me like, Walmart? Yeah. And I was like, wait a second, you've never been to Walmart? And they're like, no, I've never been to Walmart. And I was like, oh my gosh, like I'm a Midwest kid.
Yeah.
Like I grew up in St. Louis. Like we went to Walmart all the time. Like
they probably said, we've heard of Walmarts.
We've heard of Walmarts. Yeah. And so it was just a different environment. And so it was a very kind of a left leaning environment, but I wasn't paying too much attention. I was just like, I was trying to soak in all of the entrepreneurial energy of Silicon Valley.
It was left leaning, but it was different than it is today.
It is,
and I'm saying that from people who know this, right? What do I know? I don't go there. I don't didn't go there, but this is what I hear.
Yeah. I will tell you, I'm on a WhatsApp chat with all my business school classmates. Going through what we've been going through over the last 4 or 5 months with Doge and the healthcare stuff, and they're going berserk over, on this Telegram, or excuse me, this WhatsApp chat.
Yeah.
So I'm a little bit more enlightened into how they're thinking about politics now, more so than when I, was there at Stanford. But It's a different place now for sure. But back then, and this was, you got to remember, this was 2005, 2006. I got there in 2004. Really funny story is, have you ever seen the Social Network, the movie about Mark Zuckerberg?
No. Oh, yeah. I did see the Zuckerberg. The Social Network. My brain was like thinking it was another movie. I did see that.
Yeah. And so there's a subplot in the movie where
that was a great movie.
Eduardo, who is Zuckerberg's co-founder, had to go to his dad to get $18,000 to pay for this house that they were moving their company to. It was still called The Facebook.
Yeah.
That was my house.
No way.
They actually rented my house from me between my first year and second year of business school. We were all doing internships, and Zuckerberg stayed at my house. And so the funny thing about that is we came back after that next summer, and there was a receipt for the Ritz-Carlton in New York with Mark Zuckerberg's name on it.
No way.
So I went into class, and one of my buddies worked for Excel, which was the first institutional investor in Facebook. And I said, can you look at this? They're spending your money at, the Ritz-Carlton. They should be better stewards of your money. And he just looked at me, and he's like, it's going to be fine.
Yeah.
Now, he knew. But back at that time, you had to have a .edu email address.
Yeah.
There was only 6 or 8 schools or something like that had to be a part of. And so I was just like, okay, this little college campus, Facebook thing.
Yeah,
no big
right.
deal.
Who would
Here
have
it is
thought?
today. The worst financial decision of my entire life could have taken equity, which would have been worth $250 million today. But instead we were,
oh my gosh,
broke, grad students.
Needed the dollar.
And we took the $18,000.
I wouldn't have invested in either. I'd have been like, what is it?
What's this?
Yeah, that's a bad idea. That's not going anywhere. Trust me. Oh, yeah, right.
Yeah.
It's when I think about like what's come out of that era, I mean, it's amazing how in such a short period of time our lives have changed, from that whole tech era. So yeah, good stuff. When you say that you were a rule follower, that surprised me, obviously. Now, did it change later? Meaning, okay, you grew up, it's like, when would you say, yeah, I would say, here's when I started saying,
yeah,
I'm going a different direction.
After business school, so again, 2006, all my classmates went to Google and Facebook and Pinterest and all these.
So are you
places.
techie? I mean,
and so I'm not really a techie. And so I was just like, And it was at that point where I was like, I'm going to go try something different. Like for some reason, I think there's the insecurities of childhood that if you go down a different road, that's just kind of littered with potential failures. And so just the insecure little Andy didn't want to do that. I wanted to stay the path, right, that everybody else is taking. Yeah,
so there was still that thing in you, rule following, stay on the straight and narrow, stay on the track, right? Okay.
But there was this point where I was like, I'm going to do something different. So instead of going and doing this, I actually went and did a search fund.
What was it that got you to that point of saying, I'm going to do something different?
I think it was a little bit, like if I'm being totally honest, I was like, I don't think I can go and get jobs at these big, tech firms. Like I was bottom cum laude. I kind of joke in my class at Stanford. And so I was like,
not bad though.
I was like, I don't think I can get a job at, XYZ, McKinsey or Bain or, one of these consulting firms. I didn't really want to do it. I didn't think I could get a job at Goldman, which is where other classmates were going. And I didn't think I could get a job at Facebook or Google or one of these companies. I didn't feel like I was as smart as some of these people. So I was like, I'm just going to go do something on my own.
Man, you probably could have. You probably were as smart. However, it was good you didn't.
Yeah,
so,
yeah.
Right, yeah.
And so we ended up raising a search fund, and which basically is we raised $600,000 to go and find a company to buy. So that paid for my measly salary. I think I was making $75,000, where my classmates were making $175,000 coming out of school. But then you go and find a company to buy. And then once you find that company, you go back to these investors and raise the money to buy the company. And we were the only guys, me and my buddy Chris, were the only guys that were doing this out of Stanford and had for 3 years. Nobody the previous 3 years had done it. So we were kind of like the default. Like, yeah, if you want to invest in one of these things from Stanford, you invest in these guys because we were the only ones doing it. So we kind of got lucky. And so we found this little company, funny enough, in Dayton, Ohio, that was doing I've fallen and I can't get up. So you've ever seen that?
Yeah, of course. Yeah.
It was an old lady. It looks like it was made in the 80s. It was like, I've fallen and I can't get up. And there's this call center and they would call the ambulance and things.
Yeah.
So
what made that successful is that right there. You said, fallen and can't get up. I knew exactly
what it is.
Yeah.
We actually bought a competitor to that. That was way, way smaller, but it was in Dayton, Ohio. And so we moved from, Silicon Valley to Dayton, Ohio, and took over this company. And we 10x'd it in 6 years. Because in essence, when I got there, what we were looking at is our customers, and they were all, I think it was 83 years old. They had 2.6 comorbidities, and we were only responding in a reactive way.
Right.
They'd fall, they'd break their hip, they'd go to the ER. You lost a customer, and so we're like, man, this is silly. Why don't we start measuring blood pressure and blood sugars and
so smart.
Oxygen and pulse and things, so we can actually be proactive, keep these people from going into the hospital. We could keep our customer longer, add a lot more value, charge a much higher price. And so once we did that, the company took off.
Interesting, because I was wondering where this blend of what you did and what you're going to hear what he's done or doing, that explains it a little bit. Meaning you took something and were more proactive. It says, okay, it's not just about the catastrophic thing, betting someone's going to get, ill and then taking advantage of that, right? But let's keep someone healthier. Okay, so that kind of explains some transition that you're going to hear in a moment. All right, yeah. So you sold that company. I mean, you exited for some
sold
big
a
money.
Company over $100 million.
Wow.
A huge success.
And how many years did it take you to get there?
About 6.5.
That's pretty quick.
Yeah. So we bought it for 10. We sold it for over 100. We sold it for 115.
So
it was a huge success. At that point, we get the bank account, the wire to the bank account, and I was kind of like, wow, that was kind of anticlimactic.
Yeah.
Like you think you're moving towards this goal, with the end goal being a monetary thing.
Yeah.
You get it, and then you're kind of like, whoa, like what do I do now? And around the same time.
By the way, everybody that has exited a business and taken in a large sum of money describes it exactly the way you do. Yeah.
I mean, you lose your purpose.
Yeah.
In some ways, like you're going to the office every day trying to build something of value, and then it's gone.
Yeah.
And you lose a lot of that purpose.
Yeah.
Fortunately or unfortunately, depending upon how you look at it, right after that, my wife got pregnant with our first daughter, and she ended up passing away 10.5 hours after she was born. And it was at that moment where I was like, wow, I shouldn't be just sitting around playing golf and doing the nonsense that I do on a daily basis. Like, there's something more to life than just.
So the death of that child, how long after the exit?
About we exited probably less than a year.
Wow. So talk about a high, and a massive low. Boom, boom.
Yeah.
I mean,
newly married, just lost a child, went through a good 2 years of my wife and I trying to figure out how to deal with grief, because
how did
males and females deal with grief a little bit differently.
Totally.
Went through the process of talking about divorce and all that kind of stuff. It got that bad, and praise God, like we came out of that stronger than ever. But
can you take me back to that? I mean, because it is the pain to purpose, and those things form us, right?
Yeah.
Take me back to that death, if you don't mind.
Yeah.
Digging in a little bit. What happened?
So in our 12-week ultrasound, we found out that our daughter Grace had a fatal condition, anencephaly, which basically means the top of the brain stem doesn't connect all the way. So the top of her skull doesn't form, and in essence, the amniotic fluid eats away her brain until there's no brain left. So we thought.
And there was no signs of this on ultrasound or anything? You were completely surprised by this at birth?
12-week ultrasound is when we found out.
Oh, 12 weeks.
Yeah, so we knew for the remaining 6 months that she wasn't going to live.
How did you feel, and your wife at that point?
Devastated, absolutely devastated. Like you're going to make me cry thinking about it. Calling your parents that night being like, your granddaughter's not going to make it. Just absolute devastation.
When you said the way you had to handle that and your wife, two different ways, how did she handle that?
Yeah, I mean, I'm a person who wants to go in the closet and cry on my own. She wants to be the person that's with you and, cries with you. And I had a really hard time dealing with her emotion and my emotion at the same time. As you probably know, when you go through grief, everything is about you. You kind of go face inward, become, very self-focused. And so we both kind of ended up in that self-focused state where I need to take care of myself. And I was a immature, punk, of a husband. I was a new husband. I was trying to figure it out, and so new husbands and new wives have to figure out how to come together as one and live together and figure out your daily routines and all those types of things, which in itself creates some chaos sometimes. And then add a loss of a child with that. And we were just on two different planets. What is it? Men are from Mars and women are from Venus or whatever that is. It's like in that moment, I was like, we are just on two different. She was going through postpartum in addition to losing
I was just gonna...
her daughter, and so all of those things kind of culminated in, we were like, okay, let's just get divorced and be done with this. That was the easy way.
Do you have any, this is normal, I would think, even for this, but any things that you thought, what could we have done different? What did we do? Were you asking questions like that? Was it something we could have done different?
Yeah.
What did they tell you?
So my wife has the MTHFR mutation, and so I think the lack of folate or folic acid, I don't remember exactly what it was. But
so many people have those mutations, right? Yeah.
So and were we eating wrong? We were doing.
So see, but that's the point. Is I don't know that you were doing anything wrong, but the point is that it's easy to feel guilty about things like that,
for sure.
Right?
And she took it as this, and this is one of our points of contention, as my body didn't do what it was supposed to do.
Yeah.
So my body is broken. And I was like, no, babe, your body is not broken. That's not why this happened. This happens, it's for, and so that was a point of contention that I was trying to get her over. But as, we know, oftentimes, regardless of how many times you tell her, it just doesn't resonate. So she went through extensive counseling, as a result of us kind of getting to our low point. And I think, came out of that being like, okay, this wasn't me. This wasn't my body. And we are a people of faith. So we do believe that God does have a sovereign hand in all of these things, even in the death of a child. And I will tell you, when we came home from the hospital that night, without our daughter, which is every parent's worst nightmare. It was actually pouring down rain. And so we were kind of like, God is mourning with us. We get home and we started, asking ourselves, we're like, man, did we, it's just stupid thoughts going through your mind. Did we tell Grace we loved her enough? Like, what an awful question to be, questioning when you just lost your daughter. Well, that night I had a dream where I was Grace looking up at me and Steph, and just was filled with this inexplicable love that I've never, ever felt before.
Wow. And
I woke up at 3 a.m. in the morning. I was like, babe, this is what I just had. This is the dream I just had. And we just both sobbed.
Oh, yeah.
Just sobbed. And for us, it was God giving us a little bit of comfort. Like, she did feel love. And again, from my faith perspective, she's in heaven. And so, she's feeling the ultimate love right now.
Yeah. That's
again,
right.
I don't know if people who are listening to this are of faith or not, and they think that's silly, but that's from our perspective. Yeah. That was one little tidbit.
I'm a man of faith myself, so I'm right with you.
I'm here for you. So he was just incredibly kind through that. And from pain to purpose, so many of the things that are important in life only come as a result of really hard things. And I think our faith is much, much stronger now than it was beforehand.
I was going to say that. What grew out of that? Do you still cry about it?
Oh, yeah.
Well, you said...
we just had what would have been our 10-year birthday.
Yeah.
Let's see, 2 weeks ago. So every year we go to the hospital. We give the nurses cookies. I know probably not the best nutritional thing, but it just is what it is. We go to the room in which she was born and passed away. We have 2 little girls now who are 8 and 6. They've gotten to know their sister. They talk about their sister. They cry about their sister.
Wow.
So we pray over that room, and it's just a part of who we are as a family.
I wonder, maybe you know the answer to this better than I do, but I wonder if it's harder losing a child that young without getting to know them, or later once you know them? What do you think?
Yeah. I mean, I got to imagine it's being later.
Yeah.
I mean,
but I hear that grief, and I just kind of went into that with you, and I'm thinking there's a different type of grief though, because there's that I don't know, is it regret? I don't know what it is that you didn't get to know them. Well, what would it be?
Yeah.
You know what I'm saying? And you said, I didn't have a chance to show my love. I didn't have, I don't, so it's a different grief. I don't know.
Well, I mean, the great thing for us is we knew at 12 weeks. So for the next 6 months, we, went to the playground. We went and traveled with her. We felt like, when Grace kicked, I'd, push back on my wife's stomach. And so it was like, that's the only time in which we were going to be able to play with her. Yeah, and so we just tried to take that 6 months and just live it the best we could given the situation. So, another really crazy quick story. I don't mean to inundate you with this story, but we had a pastor who's a dumb pastor tell us that there's nothing in the Bible that says that babies go to heaven. And can you imagine saying that to parents?
Oh, even if you believed it, why would you say it? Right? Even if you believed it.
My wife was devastated. And so, that night she went to bed. She had a dream where she was looking at a two-way mirror. She was on the reflected side, and Grace was on the non-reflective side. Or excuse me, she was on the non-reflective side. Grace was on the reflective side looking into this mirror. And she was perfect. And she was in the most beautiful prairie of flowers that you could ever imagine. Mm. And so for us, again, it was God's way of saying, no, she's here. Yeah. She's healed. Mm. She's beautiful. You don't have to worry about her. She's good. So it was like these moments where I think God talks to us, in dreams. Yeah. I just do. Yeah. Where our faith was strengthened because it felt like he was just like, you guys are going to be okay. Yeah. And so our faith has definitely been incredibly strengthened through that hardship.
And how obviously that affected you, many ways, increasing your faith. But what impact did that have on you for what you're doing now?
Yeah, I mean, I think that people tell me what I'm doing now is absolutely crazy. They're
That's
like,
why I thought I was going to get this rebellious child. It's like, surely this, that's how crazy this is.
One guy was like, dude, you're going into a war. Do you understand this? And I was like, yeah, I kind of do. But if you can get through losing your child and almost getting divorced, like I can get through this.
Yeah, I sense that that almost split you and your wife, right? Yeah. Which is very common. When I was sick, my wife and I literally was pushing her away. Like I literally was like doing things to make her go away because of shame, guilt, who knows, right? Self-pity, you name it. But so that's normal, that you were stressed and, like you said, turned in selfishly to deal with it, both of you. And then that's, of course, that doesn't end well. Yeah. But you made it.
Yeah, we made it.
You made it.
And now we do a lot of, talking to married couples and couples who are about to get married about marriage because it's one of our favorite things. We're going to Cabo tomorrow, just the two of us.
Oh, where are you going, Cabo?
Our annual offsite to Cabo, just the two of us for 5 days.
Where do you stay?
Esperanza.
Okay. Yeah, I love Cabo.
Yeah. It's one of our happy places.
Yeah, it's easy. Meaning where we live. It's easy. Yeah. But so this was part of what you feel has formed you to the person you listen, me getting sick, of course, every bit of what I teach today came out of that, but also I needed that to be the person that God needed me to be to carry the mission that I carry. Yeah. And we had another huge trauma in our life. I mean, literally where we inherited 2 kids. They tragically lost their parents, and we ended up in court for, 3 years. Horrible, but God allowed it. And he, for me to be the person that I needed to be, I mean, honestly, he matured me through it. Mm-hmm. And so that sounds like that's what happened to you.
Absolutely.
Yeah.
I was a, punk,
like you said,
30-year-old, and I didn't know what way was up. And I think this was a maturing, endeavor for sure.
So fast forward now, you had 2 young girls now.
Yeah.
How scary was that? I'm sure. Yeah.
I was scared.
Yeah. Your wife was probably more scared.
You know what? Funny enough, is she for some reason got to this place. I think it was a faith thing
Yeah,
too,
that's a God thing.
where it was just she's just like, whatever happens, we've done this. Like whatever happens. So we had our next one 2 years later. Ava, who's now 8, and she was like cool, calm, collected. I was the one going into these ultrasounds, being like, "Oh my," like, and
I would have been scared.
I was
I have to say,
incredibly frightened. And then we had another one after that who's a 6-year-old. So we have an 8 and a 6-year-old. And yeah, I'm scared both times. And still I feel it today, like as just a parent, and I'm just probably normal as a parent, just fearful for their well-being. And I, it's probably one of my sins, but it's just one of those things where I'm kind of like, man, I want to protect my kids, which I think, ultimately was one of the reasons why I started what I started, to protect my children from the system that it lives in. And so I know we'll get to it, but that was one of the primary drivers.
Let's get to it, because people are going, okay,
like, what
is he doing?
Talking about?
He's taken on this, he's disrupted this, this paradigm in this country, and you keep talking about it. I mean, it makes total sense now, what God brought you through, for what reason, pain to purpose, right? Meaning the purpose you have today is, I believe, affecting all of us, and you're taking this on. Okay, what is it? Well, I'll let you tell the story of what brought you here, and what I believe, I was excited to do this show because a lot right now to make America healthy again, right? All the health movement that's going on. I think we're in a very unique place, as a country, for sure, that we have an opportunity to really make a difference in health. My children's generation and your children's generation is the first generation not to outlive their parents. They have more chronic disease, right? There has been a major disrupt in health of humanity. In the last 50 years, the health of children was said to be somewhere between 3% and 6%, meaning chronic disease in children 50 years ago. Today, it is over 60% chronic disease.
It's a tragedy.
What happened in 50 years? But I say all that to say this. There's a great focus on that right now, but the topic of how do we afford health care is kind of taken a back burner. And there is a lot of corruption around this, and people are making a lot of money, and people can't get good health care today. So that's a little tip of where you went with this, but tell me the story how you got there.
Yeah, so sold my company, and most of us get health insurance through our employer, so I didn't have health insurance anymore. I survived Cobra for a little bit, and finally I was like, I gotta get health insurance for my family, and the only option I thought was to go to the Affordable Care Act plan, and so I did that. I think it was $1,100 or $1,200 a month for me, my wife, and my 2 girls. And I kind of joke it worked until I had to use it. My little one was having recurring ear infections.
Until you had to use it.
And
so it worked because you were giving money.
Yeah, exactly. I'm like, I guess
it's working.
Yeah, so my little one was having recurring ear infections, and so we went to the ear, nose, and throat doc, and he's like, yeah, she's got a hole in her eardrum. So much fluid was building up in there that it basically burst her eardrum. So no big deal. We have to get tubes in her ears. It's, a 15-minute procedure. And I was like, great, I got health insurance. That's what this is for. And so we went and got it done. We were in network. My doctor got a pre-auth. Everything was right. We get the bill 3 weeks later, and it was $8,000 for a 15-minute procedure. I was like, holy crap, $8,000 for 15 minutes? Like, this is nuts.
Wow.
But then a few weeks after that, I got another note.
I'm sure like an aspirin can be literally $500. Yeah.
Well, I've got lots of stories around that if we want to talk about them, but it's crazy. And 3 weeks after that, I got a note from my health insurance plan that says, we're not paying for it. It was medically unnecessary. And I'm like, what? Like, my ear, nose, and throat doctor, she's got a hole in her eardrum. What are you talking about? It's not necessary. She went from screaming all night, every night for weeks to actually sleeping. I know it works.
That makes our blood boil as a parent, right? Because it's like, who are you to tell me that wasn't necessary?
Yeah.
You weren't up at 3 a.m., my kid's screeching, crying out in pain.
Yeah.
Not necessary. Anyway.
And it goes back to protecting your kids. Like, I felt like, Daddy Bear, right? He was like, screw this. Like, this is not right. And so I called my insurance plan. I said, I quit. I mean, if you're not going to pay my bills, I'm not going to pay your bills. So I quit. So I went back to my wife and I was like, hey, by the way, we're uninsured now.
Yeah.
And she's like, okay, so what are we going to do now?
Yeah.
And so I was like, I come to find out that I could have gotten that surgery for like $1,500 at a ear, nose, and throat doc's office in most places.
Yeah.
And I continue to find out that if you pay in cash as opposed to going through your health insurance,
Do it all the time.
it's way less.
Mm-hmm.
And I'm like, okay, so what if we put together a platform that allows people to raise money so they can actually pay their doctors directly as opposed to health insurance? And I did about a year of research. I found out health insurance was putting about 200,000 families every year into bankruptcy.
200,000
families
bankrupt. Wow.
even though they have health insurance. So these are people that have health insurance and are still going bankrupt due to a medical expense.
Man.
I was like, totally screwed up. I never wanted to go
for
back
the same reason, meaning we're not covering it.
Yeah, we're not covering it.
Right.
Or
we'll cover this.
Or their deductible is so high that, a lot of these deductibles now are like $16,000 or $18,000. So that means you have to pay the first 16 or 18 grand.
We couldn't afford insurance. So I didn't work for a company. So we just got a very high deductible, and we would go in and be like, I'd negotiate the cash price. I'd say, well, how much is if I just pay cash? Because I don't have insurance, I would tell them. That's what I did.
Yeah.
And they would be like, oh, okay, well, you don't have insurance? Oh, okay, it'll be $500 today.
Yeah.
Okay.
And so how do you do that for, not only the small bills, but also the big bills? Like, that ultimately was my
That's
big
the problem.
question. Like, what about the big one?
That's the problem.
So I figured if I could get a big enough group of people together that would all fund each other's healthcare expenses, so that these people can go and pay directly their doctor, they're going to get way better prices, which means the price for the service is going to be significantly lower than health insurance. Then there's something here. So I decided to start a company and say, can I actually get a group of people to do this together? And the answer is yes. And we've now had 15,000 people, use crowdfund their health bills.
Crowd Health was born.
And
and the premise of getting a group of people together, that if the big thing happens, it funds it because you're all putting in a certain amount of money, and it's storing up. And okay, who did the math? I mean, meaning this is a what are they called? Actuaries that actually kind of figure these things out. Is that what they're called? And but there's a math quote here. I mean, quotient, right? I mean, who did the math? Did you hire someone?
Nobody.
For that? No one did it.
No. I basically did the math myself. I was like, if I can get to 2,500 or 3,000 people, and if I have a really, really big one, I think this will be able to get paid.
So paying a certain amount.
Yep.
That's affordable for everyone.
Exactly.
And then, that money goes up. I mean, you had to look at that, though, and go, well, wait a minute. But if something bad happens to one family in the next 2 years, it could be an upset.
Yeah. And, honestly, I was in a position where I had just sold my company.
Yeah.
I made a bunch of money.
Yeah.
And I was like, worst case scenario, if this doesn't work out, then I will help that family directly, if the crowd couldn't fund it. So that was my plan B.
Yeah.
My wife, I'm not sure really knew that was the plan B, but that was the plan B if this thing didn't work out. So you kind of looked at it and said, okay, the downside of this is, I don't know, maybe I'm out $1 million or $2 million because somebody has something massive that they can't. What is the upside? You build something that can disrupt healthcare that is worth, billions of dollars and impacts so many hundreds of thousands of people. Like, that was the calculation that I did, back in April of 2021.
Yeah. And you were right. It worked.
And it was right.
Here we are. So you took the chance. It was right. You got over the hump. Let's back up just a moment and talk about the corruption in this whole thing, right? Because people are paying out a lot of money, right? And then when bad things do end up happening, they're shocked at what happened. So kind of talk about what's happening right now in healthcare, because if it wasn't horrible, you wouldn't be doing this.
Yeah. I'm going to go back to some theology real quick. Our friend Paul, who is one of the primary writers of the New Testament.
Yeah, wrote 3/4 of the New Testament.
For the love of money is the root of all evil. And some people are like, no, it's root of all kinds of evil. And if you actually go back to the original Greek, that's not what it says. It says, for the love of money is the root of all evil, which means if there is evil, money is at the root of it. And it's a pretty powerful statement. And so when I looked at the healthcare industry, I was like, okay, let's go to the incentives.
By the way, that doesn't make money bad.
It doesn't make money bad,
but it doesn't make that false.
Exactly. It's the love of. And
That's
so
right.
if we go to the healthcare space,
of.
let's take a look at who's making the money and what are the incentive systems. And so people are really confused about healthcare. And I said, look, it's not that complex. Here's the deal. You've got the sellers of healthcare, these big hospital systems. They want the highest price possible. You want the buyers of healthcare, insurance companies. They actually want the highest price possible too. And that's counterintuitive.
It is.
Because what happens is that if I have $1,000 of premium, the insurance company can only make $150. Okay, so how do they make $165? They grow their profit by 10%. My premium has to go from $1,000 to $1,100. So my insurance plan actually has an incentive to see prices rise over time.
And that's what we see.
And that's what we're seeing. So you have the buyer of healthcare and the seller of healthcare both wanting the price to go up. That's why our system is screwed up. It doesn't take a PhD in economics to figure out if the buyer and the seller want the price to go up, the price is going up.
Yeah, opposite of what a house does, right? When you're buying a house, the buyer wants the price to go down.
Exactly.
The seller wants the price to go up. So there's a negotiation that happens in the middle.
There's no market force.
And it keeps a balance.
Yeah.
So
there's no market force in healthcare. Nobody's pushing the price down.
Right.
Because you and I, as you know, if we were insured, I'm uninsured, but we don't really care what the price is. Who cares? If it's over our deductible, we don't care. Like, give me the $50,000 hip replacement as opposed to the $22,000 hip replacement. Doesn't matter. Just give it to us.
Right.
So there's no market forces pressing those prices down.
Right.
So that's ultimately what we have a problem with in healthcare. And so, you know, and by the way, in the year, you know, that they can max out at 150 so that if that $85 of medical costs go to 86 or 87 or 88, guess what? They make those reimbursements harder and harder to come by. They make those pre-authorizations that doctors have to do harder and harder to come by. There's actually a lawsuit going on right now that a lot of these health plans literally like dial up the difficulty of getting your surgery authorized based upon the amount of medical expenses they have so that they maximize their profit in year. So you're screwed in year and you're screwed over the long term because all of the incentives are against the patient and for the hospitals, the PBMs, the insurance companies. They're making the profits.
Yeah, it's a rigged game.
Yeah.
Against us, isn't it? I mean, it's, you know, there's nothing much we can do because people go, I need insurance. So therefore, you know, they have to pay. And it's a system that just can keep on rising to the point where we're being strangled.
And we're at that point.
Yeah.
We're at that point.
But people then work, they buffer it by working for a business or a corporation that is, you know, paying it, but they're getting strangled too.
They think they're not paying it. They are paying it. It's through their paycheck, but they just don't realize it.
Yeah, because the business has to make it a way to
Exactly. So it's hidden from you. You know, all of this healthcare is opaque for a reason. Like, there's a lot of money to be made when people don't understand how it all works. You know? And so the question is why then, if I go and pay the doctor directly, do you get a much better price? Well, guess what? The doctor doesn't have to get things pre-authorized.
That's right.
They don't have to have a billing staff. There's 3 billing people for every doctor in most places. They don't have to wait for their money. You know, they have to wait 3 or 6 or 9 months to get their money.
Oh, and that's the case. By the way, when I was practicing, I got out of the insurance game. Everyone thought I was crazy because, well, insurance paid our bills. Yeah. Right. My staff thought I was nuts. I was done. And you know what it took for me to be done? A few times where they said to me as the doctor, "Oh, we don't think that was necessary." Meaning, wait a minute. So I was on the opposite side. So all that treatment that I just gave this person, you're saying that you don't feel it was necessary. It's like, so when that happens a few times and then they don't send you your check for $15,000 and it's a year later, you know, it's like, okay, I'm not playing the game anymore. Come in, people. I will give you, you know, way better deal and make it way better affordable. And my practice actually exploded.
And
I took the insurance out of it.
Well, and now it's between the patient and the doctor.
That's right.
You don't have a government, you don't have an insurance company, you don't have an employer in between telling you, doc, what you can do with me. It's now between me and you. I'm paying you.
Yeah.
And so I always say, like, you work for whoever pays you.
That's
you
right.
know, and in this relationship, you're working for me now.
That's right.
Whereas with the insurance relationship, you're kind of working for the insurance company.
Yeah, no doubt about it.
And
Because and what that means is I'm only going to do treatments to you if they're going to pay.
exactly.
So even though I know this treatment's better for you, I don't get paid there. I have to do that. See, now I am working for them and not you. Now, take them out of the picture. I'm going to give you what I think is the best. And then you and I are going to, negotiate what we think is the best price. Here's my price. That's fair. Good. Let's go. Let's go to work.
You do for everything else in life.
Exactly.
It's an exchange of value.
Yeah, absolutely.
And so when our members go to the doctor and say, I'm paying in cash, the doctor's like, wait, what? I can actually practice medicine now. Like, let's talk about what's going on with you.
Yeah.
So it's totally changes the dynamic.
I have friends in the system differently, right? An orthopedic doc friend of mine. And I'm like, he's telling me the horror stories, right? And I'm like, well, dude, just get out of the system. Like, what? What? Yeah. He really thought it was impossible. Like, you can't. I'm like, what do you mean? He's like, because people won't pay. I said, yes, they will. They will pay. It's like, and, because they will value your care and you can offer them a great discount and da-da-da. It's like, it's like, so anyway, the bottom line is that, here we are where doctors have to get out of the system. Patients have to get out of the system. You've came up with a better way for people to do just that. I have to say, when we look at this broken system, what we're missing is one more part of it. This system, it rewards bad behavior and it doesn't reward good behavior. Meaning with this system, there is no incentive for the patient to take care of themselves or no incentive for the doctor to tell them to, and nor incentive for the insurance company to care. So it really is not none of it has to do with prevention. So your system focuses more on prevention and actually has a part of it that is about prevention. Kind of explain that, because so you've developed a system that, will deal with the big problem when it happens. Brilliant. And now you've also dealt with a part of it that actually helps reward good behavior.
Yeah. I mean, if you get car insurance and you're a great driver, you get a better rate than the non-good driver.
That rewards good behavior.
You rewards good behavior. You think twice about speeding or reckless driving or whatever, because you're gonna have to pay for it.
Yeah.
Ultimately, you can't do that with health insurance. It's actually illegal to do that.
Isn't that crazy?
Which is a crazy thing.
Isn't it?
Even though I don't know what your stats are, but something like 80% of chronic diseases are lifestyle-related diseases that people could change.
Yes.
Type 2 diabetes is probably
and
reversible.
Therefore, that would drive healthcare costs down. This
Crazy.
makes total sense.
Crazy.
Yeah.
Crazy. So we actually do have a program with Crowd Health where we're looking at two kind of things that we think are proxies to good metabolic health, which is visceral fat and fasting insulin. And so if you have
they're important.
Fasting insulin, I can't remember exactly if it's below 5 or 5.5, something like
below
that.
5.
Below 5, I think it was. You get a 10% discount off of your Crowd Health membership.
Well, yeah, I answered that question not knowing what your number is, but I know that below 5 is optimal.
Yeah. And then if you're in the bottom 25% of the population in terms of visceral fat, then that is, indicative or good proxy for metabolic health. So you get a 10% discount for that too. So you can get up to a 20% discount off of Crowd Health for.
But by the way, just from a business standpoint, that makes sense, right? Because wait a minute, if I want to make this affordable, right? If I bring in healthier people and they have an incentive to be healthier, to get a discount, we're going to pay out less premiums. That makes total sense to me from a business standpoint. Yeah. Okay.
So and the only other things is, if you're obese, then you're not allowed in the community. And if you're a smoker, you're not allowed in the community. And the community members value that.
Absolutely.
Like,
I don't want to pay for their bad behavior.
Exactly.
Yeah.
And it sounds.
But I don't have a problem paying for the catastrophic thing or, bad things happen, right? Even people that take care of themselves, things can happen. I don't have a problem with that. But, right, if someone is absolutely abusing themselves, now I have to pay for their heart attack?
Right.
I don't like that.
Well, the number one expense for the community to date has been pregnancies. We just got a lot of people in their 30s.
That's awesome.
Which like, I'm cool paying for babies. Like, I'm all about it. Let's reproduce. The second is active injuries. So people, mountain biking, face plants, and skiing.
Bad things happen.
Every winter we get all kinds of skiing injuries and things like that. It's just like bad things happen, and I want people out active, living life. and I'm happy to help people.
Absolutely.
And it's like 7%, I think was the last time I looked at it, was like illnesses, like cancer, things like that. We've had 36 cancer cases, so we just have some of those. As a
So,
part of
I mean,
just,
do you attribute those amazing numbers that you just said, very little chronic disease to the, basically awarding good behavior and, who you take in, who you don't?
I think we're self-selecting. The group is self-selecting. It's a group that was like, look, I'm healthy. I want to be a part of a group that's healthy, that's taking care of themselves. And by the way, I get a discount if I'm taking care of myself. So I'm luring in people who want to take care of themselves, and so it's a self-selecting group.
Can I ask specifics?
Yeah.
What is it a month? Do you have different programs?
Sure.
Is there a deductible? How does it work?
Yeah. So 2 payments every month. It's $55 a month to be on the platform. So that just gives you access to the platform. That comes to me. That pays my bills, and then up to an additional $140 a month per person. Or $420 for a family of 4 or more.
That's really cheap.
Yeah. So as an individual, you're at about $195. As a family of 4, you're around $640, $650, something like that.
Yeah.
So significantly less expensive. And that second component, so that $140 is going directly to another human being in the community. So it goes from your bank account to their bank account.
Right.
And we have some fintech on the back end that makes sure that it gets there and all that kind of
So
stuff.
I'm not paying for the guy to fly it a Learjet across the country. Yeah.
Yeah.
I love this.
We for example, we have, unfortunately with pregnancies, we get a lot of miscarriages too. Just happens. And so we inevitably will send out something for a miscarriage, and women will come back to us and be like, I've been through that. I know what pain this family is going through. Like, can I, instead of giving you $100 this month, can I give you $200 this month? And that's because it is a human-to-human transaction.
Totally different.
As opposed to me sending my money to United Healthcare, which is, I don't care. Like,
what is that?
I don't want to send it to United. I have no idea how they're spending the money. My money is going directly to that person who had a miscarriage. I know exactly where my money is going. And so I actually feel good about paying my monthly bill.
So here, let's take a real life situation.
Sure.
The earache, right? Just that was your situation. So take me through that, right? So I go in, my child has an earache. I get the bill. How does it all work?
Yeah. Can I give you a different example? Which is a really good actual example. Yeah. I met this guy last week. We took 100 of our customers to Vegas and had a party just because it's what we do.
Oh yeah, but my health insurance company takes me to Vegas.
Exactly.
Yeah.
So I met this guy who I've talked about a lot. His name is Michael. He was in Montana and he was fishing, and he was bear country, wolf country. So he had a 44 in his holster, and so he was fishing. He leaned down. The 44 fell out of his holster. Hit a rock perfectly.
Oh my gosh! You hear about
bullet went off, went into his calf, out the back of his calf, into his thigh, out the top.
This happened to a friend of mine,
and out the back.
Oh my gosh.
1 bullet, 6 holes.
What?
So his wife, had to climb to the closest hill, called 911. They medevaced, got a chopper in, basically pulled him out of a stream. He went to the ER, which was like 2 hours away by car. So we couldn't do that. He had been dead by then. Went into a coma, had all his surgeries, had to drive home because they wouldn't let him take an airplane. Went into sepsis on the way home, so had like 104.5 fever. So he went into sepsis. All these things. This is $1 million bill. So what we do is we take that $1 million bill. We've got a team on our side that negotiates these bills on behalf of our members. We got that bill down to somewhere between 200 and 250 grand. So down about 75 or 80%. We've sent that out to the community, and it was funded like that. No problem. Super easy. The great thing about the ER is they have to treat you the same way regardless of your insurance status. It's a law. And so you'll get bills after the fact. So all you have to do is just take a picture of the bill. It comes to us. We scrape it. We make sure that it's fair price. We make sure that it's, you actually got the service. We'll negotiate it on your behalf. And so it's super easy.
When you say then you take it to the community, are we asking for donations for it, or is there a system, the money the money's been paid in, a portion of that for it? So you just use that money?
We're going to ask you once every month for your $140.
Right.
So I'm going to ask you.
So that money's sitting there waiting for a catastrophic
Not yet. It's
event.
Still in your bank account.
Okay.
You can say yes or no to giving Michael, who shot himself.
Okay, so I have this accumulated money sitting in there. Let's say it's 20 grand at this point, right? That I've accumulated.
You actually, all the money other than, so this is totally different from health insurance.
Other than the
right?
$55.
So the $55 comes to me,
Okay.
and every month
To run the whole
you're
thing.
going to give up to $140 directly to somebody else, which means there's no money stored up.
Okay, so
anywhere.
in other words, it could build up because I haven't.
It's in your account, right?
Yeah.
In your own personal
Yeah.
account, if you'd like to.
Now, is there rules that I have to give it, or what if I go? Yeah, I don't like any of this.
Okay.
Oh, yeah.
It's a great.
I mean,
question.
so now it's at $20,000.
Yeah,
right?
it's a great question. So if I asked you to help Michael, who shot himself,
Uh-huh.
and you say no, then the time that you submit bills to the community sees the last 10 times you've been asked.
Aha.
Have you been said yes, 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 or have you said no, 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 no? Right. And so
right.
if you said no, 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 you're not a good member of the community. You're a taker, not a giver. Right. So there's a
Yes.
community component of this
Yes,
where
yes.
reciprocity.
Yeah,
is
say
the engine.
again, it rewards good behavior.
It rewards.
Right. It's like,
incentives.
I want to
It's
give,
all
I want to give.
incentives.
And
It's all
there's
incentives.
no way of someone building up money, a taker, and being able to use that money for anything else anyway.
99.9% of the bills that we've submitted to the community have gotten fully funded. The
Yeah.
0.1% that haven't gotten fully funded are the people who think they can say no, 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 and then submit it to the community and expect the community to be like, yeah, I'm going to help you, even though you didn't help the rest of us.
Mhm.
So those are the only bills that haven't gotten funded through the community.
It's a bad egg. All right. Yeah. Like Willy Wonka, you have to have a way of getting rid of the bad eggs.
Yeah.
Yeah.
And by the way, I say up to $140 a month to help somebody else out in the community, because
Give
if
more.
we don't have enough bills in the community, we're not going to ask for that $140. So this month we're only asking for $90
Yeah.
of the $140, which means you get to keep your $50. You can go and buy a steak or buy your wife a gift or whatever you want. We're never going to take it from you. And so it does also incentivize the community to keep bills down, because you as a community member are benefiting from that. So an individual with Crowd Health this month is only paying $140 or $145.
It's brilliant, man. It's
There's only one more component of that is whenever I personally believe that if somebody has a health event, they got to have some skin in the game, because I think if you don't pay anything, there's then the incentive to, consume to infinity. And so our members pay the first $500 of any health event. So if you go to the ER, it's $500.
Okay.
If you shoot yourself, it's $500.
Yeah,
If you have
that's good.
cancer. It's
Yeah,
$500.
I think that's smart, because you could get a hypochondriac. You could get someone who
Totally.
People like going to doctors
Yeah.
sometimes. It sounds very weird, but it's true, right? It's like because they're very paranoid, so they're always going. You have to have something to buffer that little hurdle to get over.
And we feel like $500 is a good number. Anybody can come up with $500.
Yeah.
You can figure it out.
And it's also enough to make it a hurdle.
Yeah.
Right. So you're not just abusing the system, keep showing up because you got a headache.
100%.
It's like, I had a headache too this week,
It's
but I
worked.
didn't go. Yeah.
It's worked beautifully. I think we're on bill 30,000 now or something like that over the last 4 years. And like I said, 99.9% of them have gotten funded. Everything from little pediatric bills to people shooting themselves to multiple cancer cases, NICU babies, brain surgeries, heart surgeries. We've done it all.
Because you've disrupted the system. Number one, where do you see this going? How disruptive is it? Number two, have you gotten pushback anywhere?
Yeah, the first question, like I don't know why anybody ultimately would choose health insurance over Crowd Health once they realize how reliable it is.
Yeah. Is there any advantage to regular health care? Honestly.
If you're sick, there's an advantage.
Okay.
Yeah. I mean, if you
you mean chronically sick?
Chronically sick.
Yeah.
Then go get health insurance.
Okay.
Yeah, there's a benefit to health insurance for.
But the problem
health.
with being chronically sick is that they've got ways to squeeze you too.
Sure.
You know what I'm saying? That
Deductibles are one way.
And my argument from that is that because they have ways to squeeze you, you don't get the best care. You're getting the only care that they offer.
Mm-hmm.
You have to understand, I'm thinking from an alternative standpoint, right? They're not paying for that. They're not paying for ozone treatments. They're not paying for, for you to do cellular detox. They're not paying for any of that, right? That's an issue. So you're stuck with whatever they think is good, which I think is sucks.
Typical Western medicine, which, run by lemmings.
Yeah. So if that's the only benefit, I don't even see it as a benefit, but okay.
Yeah.
Maybe.
I mean, look, I think maybe the only other benefit I think is a downside, but like people are comfortable going to their doctor and just laying down their credit or their insurance card and then not having to worry about it.
Right.
Until they get an explanation of benefits and you have no idea why they pay all this money. So You know, we ask people that, like, look, if you have a big event coming up, will you call us so that we can help you find a really great doctor in that location, in that city? And, you know, typically what we'll have is a really great doctor who will take cash, who will give you a great price for, you know, a cash pay procedure. And so we just ask people to call us, or else they're going to go get, you know, $40,000 knee replacements when you can get it for $22,000.
No, totally. I mean, y'all are going to be able to negotiate that much better. Do you see a time where it's covering more alternative therapies, procedures?
Yeah, I mean, I think
And where do you draw that line? How do you draw that line?
I think it's one of our challenges right now is where to draw that line, because we don't really care what doctor you go to. So we have naturopathic, we have integrative, you know, all kinds of people go into those doctors, which I love. They get to root core issues.
Right.
They are a little bit more expensive than your kind of allopathic, you know, doctors. I'm fine with that. I think, you know, our challenge, and maybe you can help us with this, is bifurcating or figuring out, like, the quacks versus the people who know what they're doing.
Yeah.
And so we had a guy who, you know, was like, came to us and was like, oh, there's this surgery. It's the only guy in the United States who does it. And it's $100,000. And he promised me he's going to, you know, fix it. And you go look at his reviews and they're all like, didn't fix. And we're like, dude, like, you know, this is not right for the community.
See, yeah, exactly. So, I mean, how do you make those decisions? Do you have a board of people?
We have a board.
You don't want to make those decisions. I don't want to make those decisions individually.
Yeah.
Even, you know,
ultimately we filter. And if we say no, he has an ability to appeal, and actually goes to 5 members of Crowd Health. And we make a our like, hey, this is why we don't think it should get funded. And then he says, hey, here's why it should get funded. And then our members ultimately decide if it gets.
So you could bring anything, you know, to it. Meaning, like, hey, I want to go get these 12 EBU. I don't know if you know what EBU is, but it's an ozone dialysis. I want to get 12 of these because, you know, they say this is going to be helpful for my autoimmune condition. They can bring that to the community.
They can bring it to the community.
And then it will go through that process and they will look at it and, oh yeah, there is some legitimacy here for autoimmune, you know, let's do it.
Totally.
Right. Okay.
Yeah.
All right. No.
And we have people, I don't know where you're at on like acupuncture and things like that, but we have people who do acupuncture. I think that's right. They do ozone stuff. Ultimately, I was like, hey, it's between you and your doctor. What do you want to do? And a lot of these therapies are very reasonable.
Yeah.
Some of them are not.
Yeah,
You know, like
exactly.
are very expensive.
Right.
But most of these are reasonable. And if it's reasonable, we're like, sure, go ahead.
I mean, there is this line that you have to decide if you want to cross or not. Meaning, I think that we pay for insurance for our cars when they get dinged up, banged up, right? You know, and there's a deductible. It works, right? There's an incentive to keep our cars running good, and there's an incentive to put new oil in it. But that's out of us. That's, you know, to take care of the car. We are all willing to pay out of our pocket to take care of the car, and then we expect insurance to do this. It seems so clean when we deal with cars.
Yeah.
Right? Why isn't it as clean when we're dealing with our health? Meaning, like, I think we have a certain responsibility to say, well, I'm going to do these things and change my oil, right? You know the analogy I'm saying here, right? And but it's not the insurance company job, the crowd. It's not their job to maybe change the oil, meaning the things that you do, your breathing classes,
right?
Your exercise, you know, those are things that I think you're responsible for. Where do you guys draw the line there?
Yeah, I mean, a lot of this reason was it was put into law. I mean, it was put into law, you know, 15 years ago now or so, you know, that these health insurance plans have to pay for all of these preventative things, where I don't think I think I should be paying for my primary care doc. It's a once a year thing. If I want to pay for labs, I should be paying for my labs. They're not that expensive. These are the oil changes of our bodies that we need to be doing. And so we really are trying to focus on helping people with the big stuff,
right? The
big stuff that happens, the dings, the dents.
So you're more like the car insurance. Right?
Exactly. We do, have a $300 per year wellness allocation. So, it's up for one visit. You can use it however you want. And we're just trying to incentivize people to go to the doc. And if it's more than $300, which oftentimes it is, you own anything above $300, the $300 can get sent to the community. But it's great. We got a lot of babies, pediatric visits and things like that. So it works for the community. but we are, very focused on our people. I'm getting as much money back to our people so they can spend their money the way they want to spend it,
That's the point.
as opposed to,
That's the point.
some centralized authority choosing the way.
Because-
I saved $10,000 last year on Crowd Health just with my family. It's probably closer to 20 actually. And I was like, now I have $10,000 or $20,000 to go and spend it on my healthcare, whatever way I want to spend it.
Right. I mean, exactly. I'm going to buy all organic. It's more expensive, but I value it. I understand
Exactly.
the hell. I'm choosing to do that. I choose to join this gym. I choose to, whatever it is, do cellular detox. I choose, those are things you're able to do because of the money you're saving, and you should value it and choose it. So that's the way I see it, for sure. I think this is, just a huge breakthrough. Do you think it's going to get more accepted? I mean, where do you see it going? You said you had what 20? How many members?
We currently have 10,000 members in the community.
Okay.
Yeah. And I will.
And do you see other of these starting up? I mean,
not
where there's
so
Coke,
far,
there's Pepsi. I mean, in the sense that,
interestingly.
yeah, that's amazing.
Yeah, interestingly enough, nobody has started up because I think everybody thinks I'm kind of like, excuse me, language, like batshit crazy for doing this.
Yeah.
And a lot of people who are in this, people think they're batshit crazy for being in it. But I would tell you, over the last 6 months, we have seen a significant increase in the number of people signing up. I think that
How do you market it? How do you market it?
We go on podcasts.
Yeah.
We tell the story.
Right.
People, once they hear the story, they're like, this
Yeah,
system is really
give them how they sign up.
broken.
Go ahead and give it.
Yeah,
right now.
joincrowdhealth.com.
Joincrowdhealth.com.
It takes 5 minutes.
Yeah.
You can start whenever you want. You can end whenever you want. It's a month to month. So
cheap. Yeah.
it's worth a shot to get over this, cartel that is the medical industrial complex.
Really is. Yeah.
Yeah, it's simple and easy to use, and and one other thing too is I want to mention is pharma is clearly a big concern for people. We can actually go to the pharmaceutical companies and negotiate with them directly too, without the PBM in the middle.
Yeah, because there's people out there watching this who are be like, listen, I can't do it because my insulin is right, and this.
Yeah, we can help.
is-
We can help.
Yeah.
We can help. We had one woman with, I think it was lymphoma, where her monthly med was $40,000, and we went to the PBM, or the pharmaceutical company directly, and got it down to $2,500 a month. So I mean, like, what is that? 80% reduction? No more, 90% reduction.
Yeah. Oh.
And so we're taking a very active role in helping you negotiate these bills. And we don't ask you to negotiate. We just, hey, if you need help, just call us.
Now, if I'm out there, are there anything that you're selective who you take, right? Maybe there's someone out there going, well, they're not going to take me. I have diabetes. They're not going to take me. I have a thyroid condition. They're not going to take me because I have, or what's the stipulations there?
The only people we won't take is if, like I said, smokers, overweight, and then 65 or over, we can't, only because of some stupid Medicare rules. I think we've got a solution to that. So if people are over 65 or bummed that they can't join, just wait for a few more months and we might have something for you. And then other than that, we've got a ton of people with type 1 diabetes. And what they found is they're like, look, Crowd Health can help me find my insulin and my supplies way less expensive. We do ask them to own that for the first 2 years that they're in Crowd Health. But they are saving so much money that they're like, I'm saving $10,000 a year. My supplies are nowhere near that. And so I'm more willing to do this than going with a health insurance.
I want to somehow be on the part of, if you have those conditions, your body can reverse those conditions.
Well, especially type 2.
Yeah,
right?
absolutely. Yeah, it's like, these are reversible conditions. Thyroid, Hashimoto's, type 2 diabetes. These are reversible conditions.
And some of these meds too, these thyroid meds, blood pressure meds, they're super inexpensive.
Yeah.
They're not that much.
Yeah.
So my own sister was on a blood pressure and a thyroid med, and I think it was like $22 a month or something like that she had to pay.
Yeah, but people don't know that because they're like, I'm trapped in my insurance because my insurance, it's like, it's $22 a month. Like, it's like, not, but you have to negotiate it for
Yeah, exactly. So, and we help you with that. We give you websites that you can go on and see it. And so, it's pretty easy.
What part of Crowd Health is the most meaningful for you?
Yeah, I mean, I think one of the things that I hated during my health insurance experience when I was fighting with this health insurance plan is I would call the health insurance plan and I would be like routed to some, you know, call center in India or something, and I'm like talking to somebody, I'm telling them about my healthcare issue, and they're like, one, I had to wait 30 minutes to talk to them. Then I talked to them, I was like, oh, you're in the wrong group. You have to go to this group. Then I had to say it again and wait, and I hated it. And so at Crowd Health, you have a care advocate that you are assigned to when you sign up.
That's huge.
So Kelly is my care advocate. Every time I have an issue, I talk to Kelly. Kelly gets to know me. I get to know her. I schedule a time to meet with Kelly. I can text her. I can email her. It's super easy. And you get these relationships. And so one of our care advocates, Naram, a mom called him and was like, my son is actually in Colorado, your neighboring state. Son was out hiking, fell, busted his face open, and had to get stitches and go to the ER and all that kind of stuff. The crowd funded his care, but his mom called and is like, yeah, what the bummer about this is the little guy doesn't want to go hiking with his dad anymore. He's scared. And so Naram bought this little kid a little climbing set that he put in his living room with a little note that says, we hope your buddy gets back to adventuring. And so the mom was at this point crying, being like, that's so thoughtful. And so those things that we love our members really, really well, that like gets me fired up. Like we always say that we legit care for our members, and we do. We love them really, really well. So that's my favorite part.
That would be my favorite part.
And I think a little bit comes from that. Like we felt loved when we were going through our situation with Grace. I'm a girl dad, and so there's just a piece of me that was like love my girls really, really well. And so that is a core component of our culture, is like we want to love our members really, really well. We're up 300% this year versus last year.
Wow.
And what I say, and most of those new customers came from our existing customers. So I always, people don't want business advice, but my business advice for you is love your customers really well, because they're going to love you back. So most of our new customers are coming from our existing customers, which is the easiest marketing of all time.
Yeah, of course.
And they're great members, because friends of people who take care of themselves typically take care of themselves.
They're going to refer the right people.
And so you've got a super strong crowd of people, because it's just good people referring good people, referring good people.
Yeah.
And that's why we've been able to grow 300% over the last year.
Brilliant. How does Gracie's story, because you kind of alluded to it there, how does Gracie's story shape the work you still do?
Yeah, I mean, I think it's honestly, I think there's been a softness to my personality that was created, or was maybe some of the rough edges were shaved off.
God's purpose.
Back to purpose. I think there was a softness that came out of that versus probably a do it for the money, do it to get something big, do it to get the chip off your shoulder, do it because you want to hit the home run. And this one's more like, I want to do it just because I want our members to feel loved. I want to do something missional that actually changes healthcare for the better, and not just healthcare, the system, but like these individuals, these human beings who are members of our community. Like that's why I said, when you said, what's your favorite part, is I love sending that little kid a rock climbing thing so that he can get back and adventure with his dad.
Yeah,
like,
that's awesome.
That's what makes my day when I hear those stories.
Yeah. Do you think you'd even be doing this without what happened to Gracie?
I doubt it.
Yeah, you doubt it.
I doubt it.
What do you wonder what you'd be doing? What do you think you'd be doing?
I don't know. I know I'd be having a lot less fun.
Yeah.
Probably playing golf or fishing and stuff. I just want to do
so much more fun and meaningful, when there's purpose in what we do, right? And called to it. Now, obviously, we both feel that. That's the whole pain to purpose, thing, right? And I loved right from the very beginning when you said, man, I got this big check, showed up in my bank account, and it was like, it wasn't the feeling you expected. And I can't tell you how many times I hear that, right? So, because I think that many people are still working towards that. Like that's going to set them free when they build this and have it. It doesn't, folks, right? Yeah. So what pains are in our life that God is trying to wake us up into a new purpose? That's the question I have for you all.
Yeah.
Yeah.
Well, I mean, one of my favorite places in the world, and I think, ultimately after Crowd Health, I will do mission work, is Africa. Like, Africa is one of
Been there 3 times.
Yeah, I've been there 8 times. It's one of my favorite places in the world.
Yeah.
And we were actually talking about this with my wife and my girls last night, of just the joy that some of these people have that you meet there.
Yeah.
Even though they have nothing. Like, they're living in tin huts.
Oh.
And they don't rely upon cars or houses or bank accounts or any of these things for joy. They have this innate joy that they really have to lean on God for all of their needs. And so there's a faithfulness there and just a joy that I'm like, I remember seeing this little girl 2 or 3 times ago, just running up with the biggest smile on her face. And she just ran out of a shack where they have to eat, sleep, poop, and pee in the same place. And she's got this joy about her. And you're like, where is that coming from?
Yeah.
Right?
Yeah.
And so it makes you really think all the things in life. And that's why I think the big bank account was like, yeah, we have to go to Cabo. And it's fun. My life in Cabo is a blast.
Yeah, yeah.
No doubt.
I love Cabo too.
Yeah. So I'm not downplaying that. But I do think there's some joy that comes
Yeah, but
from
it's
sort of
not,
total
I mean,
reliance upon
money can bring us things, fun things, right? There's fun in it, but it doesn't, there's a difference of having fun than fulfillment and purpose. You can have all the fun you want and not be fulfilled.
Sure.
As a matter of fact, it gets even harder to have fun when you're not fulfilled, right? So, yeah, money can buy like what appears and looks like fun, but if you're not fulfilled, I don't know.
Yeah, it's kind of happiness versus joy.
Yeah, exactly.
Right.
Yep.
Money can find you temporary happiness, but it does not give you long-term joy.
Absolutely. All right, look to the people there. Tell them, why they should do this, and then remind them where to go.
Yeah, look, if you want to join us in what I say is burn down this system, I think is worthy of being burned down because it's burning so many different people. Join us on this mission. Yeah. We'd love for you to join us on the mission. The only way that we change things is for you to vote with your wallet. So come and vote against this system. Join us. I promise you we'll take good care of you. JoinCrowdHealth.com is the website. Join Crowd Health on all our social media platforms if you want to get to know us a little bit better. There's an opportunity to meet with a member advisor if you have any questions, because this system's a little bit funky, especially when it's a little bit different from health insurance. But yeah, we'd love for you to join us and be a part of the crowd.
Yeah, that was awesome, man. Yeah. Join with your dollar, or vote with your dollars, right? Yeah, and you should join to do that. But yeah, well, look, the Dr. Pompa podcast, right? You're a disruptor, man. I really appreciate that.
Thanks, brother. I appreciate it.
Yeah, but from pain to purpose. And again, challenged you already, right? Look into the areas of pain. Maybe God is working on you right there to open up a new purpose, right? And that's why I love these stories, because you opened even me up to like, what more can I be doing?
Yeah.
And I'm sure them as well. So thanks for joining us on Pompa Podcast. Thanks, man.
Thanks.
Yeah.